The U.S. healthcare system is heading into one of its most monumental years since the 1960s. This year, Americans will get their first look at how the Affordable Care Act changes the way they get treated by physicians, hospitals, insurance companies, and others in our huge healthcare system. Now, one of the leaders in this changing marketplace is the Cleveland Clinic. President Obama has called it a role model of healthcare delivery. Joining us now, we're happy to have Dr. Toby Cosgrove. He's the CEO of the Cleveland Clinic and author of a new book, The Cleveland Clinic Way. It's a look at trends that will define the future of medicine. Toby, great to have you on the program.
Nice to be here, Susie.
Let me begin by asking you a question you probably get asked a lot. I mean, now that the Affordable Care Act is here, a lot of people are wondering about two things: quality of care and cost. Is care going to be better, worse, the same? And is it going to cost us more?
Well, I think the important thing is that the Affordable Care Act started out to do three things. It wanted to improve quality, and I think the transparency that's coming with it is going to help quality, because we've seen quality go up as we have more transparency. We also know that access is a big issue around healthcare. We can't really tell what the access is going to be like around insurance because it's too early to tell that, but we do know that we've made significant improvements in making access available at all of our locations. We've taken our emergency rooms, and there's now 11-minute wait from door to doctor. We have same-day appointments, all of which has the ability to improve the access of the patient to a physician in which they want to see. And the real question is going to be around cost. And frankly, I think it's too early to tell about that. We know that there's going to be less money paid to hospitals, so we're going to have to be more efficient, and hopefully that'll bring the cost down across the entire country.
Do you expect, Dr. Cosgrove, that the Affordable Care Act will increase the likelihood that people will seek out care, or will it decrease it? I've spoken to several physicians recently who fear that maybe it will decrease their willingness to seek out care as they realize that their deductibles are so much higher than they used to be.
Well, I think one of the things we've seen recently is we've seen the rate of inflation of health care go down over the last several years, and now the high deductibles are now 33% of insurance policies. And I think that's one of the things that accounts for the decreasing rate of inflation of health care. It was the first time we've seen that much, that low in a number of years. So I think that remains to be seen. There certainly is going to be more of an emphasis on individual taking responsibility for the financial aspects of their health care.
So we are at sort of an inflection point about healthcare with this Affordable Care Act. And obviously the Cleveland Clinic has a very successful business model. But given that we're going into this new phase, what kinds of steps is the clinic taking this year, today, to prepare for all the changes? I mean, are you hiring more, or you're letting people go? Are you cutting? You talked about costs. Are you cutting costs? Are you thinking about acquisitions?
Actually, we're doing several things. We know that we have to have a more efficient delivery system, and we're taking costs out. We've taken in the past 2 years $180 million out of our purchasing, and we need to take another $330 million this year out of our cost of delivering care for our organization and more in the outgoing years. We're also looking at efficiencies of healthcare by bringing hospitals together so we can share resources and have collaboration, so everybody doesn't have to have their own data center and everybody doesn't have to have a huge back office to support them. I think that will all help us drive the efficiency of the healthcare system.
If you were the healthcare czar, Toby, and you could make one change that you think would be the best change in the way we receive and you deliver healthcare to us, what would it be? Would it be a single-payer system? Would it be paying doctors just a salary and getting away from fee-for-service? What is it?
Well, I think there's lots of things we have to emphasize. If you look at what causes premature death in the United States, 40% of it is related to behavior: smoking, lack of exercise, and obesity. And if we're going to reduce the cost of health care across the United States and have a healthier population that's living longer, we have to address those things. And I think we can do that by raising the understanding of those problems across the entire country, and I hope that we'll see that come in the next future years.
All right, that's an interesting answer. Thank you so much, Toby. Very nice for you to come and share this conversation with us. Dr. Toby Cosgrove, CEO of the Cleveland Clinic.